So first up today, we're going to talk about the Spinal Cord Injury Health Maintenance Tool, which was launched last week on the 5th of September. And we've got Dr Mohit Arora here to speak to it, who's a Postdoctoral Research Fellow at the John Walsh Centre for Rehabilitation Research in Sydney, and responsible for the development of the health maintenance tool. And we'll talk about the tool and answer your questions. So thanks, Mohit, for coming, and over to you.
Thanks, Tony. Can you hear me okay, everyone?
Yes.
Okay, thank you. All right, thank you, Tony, for that introduction. And I would like to start by saying thank you for inviting me for this important forum. I was very excited when I was asked to present today. And as Tony mentioned, I will be going through this amazing resource, what we have co-designed and co-developed with people living with spinal cord injury. And I did notice that some of the people who were involved in this project are also attending this forum today, which I will mention later in my slide about their roles and contribution. So I'm one of the researchers at the John Walsh Centre, which is based at the Calling Institute, which is in the Royal North Shore Hospital campus, and it's part of the Sydney University affiliate centre, one of the centre. So before I move, I just wanted to thank Tony for acknowledging to the country, and I will not acknowledge again because Tony has done a wonderful job with that. So moving on, I will just present with this like a slide snapshot information about the health maintenance tool for those who are not familiar what this tool is about. So just like a quick snapshot, the health maintenance tool is a consumer-friendly tool that is co-designed for consumers, from consumers living with spinal cord injury, to provide guidance on self-management, when to seek further just-in-time medical attention or some strategies which you can use in your daily activities or life. The health maintenance tool is the guide and a compendium of health information to assist people living with spinal cord injury in their self-management. In the current version, I can say like the tool is like developed like to cater the need of multiple users depending on their learning style, their accessibility style, and we will discuss some of those features as we move on in my slides. Just a quick accessibility feature that within the tool, if you did not have an opportunity to scroll through the website or the booklet version, we have used a lot of practical solution, some interactive elements like use of navigators, use of some images and illustrations. They're like some very handy and helpful screening tool, which I will like talk as I move on in my slides, which is part of my slide today. And then we also use some easy to understand language where we use like this very unique software where we can tone down the medical jargon to a layman person language to level 8. And we have also highlighted like a lot of key facts which are like coming from the research we did in the side way of our like consumer engagement process. And there will be some links where you want to explore a particular topic in more details. You can always click some of those future or further reading links and go to that easy to navigate sections as well. Before I just like going how you can actually utilize the whole tool to its maximum potential, I just wanted to give like a bit of background and rationale why we needed this tool and why we thought it should be like done in a way that it should like not just empower people living with spinal cord injury, but also give them that sense of autonomy when they're like dealing with their daily life, like health related needs or issues. So there was like one previous study which was done in 2012, I think. And that was done in New South Wales, where there was an audit of all the rural clients which are seen by Royal Rehab from 2008 to 2012. And then during that time, they identified some of the common health problems which was seen more frequently. And then there was also a consensus that there is no such tool which give them like an understanding of which is more consumer friendly to support them in their daily life to manage their like just preventable or like some complex health related issues. And most of the time we were told in that audit report that clients were also given inconsistent information, which was making very hard for them to like reintegrate back into the community, because it was very challenging at the time, because a lot of people like getting different information at like different resources and same time, and it leads to like increased risk of secondary health condition. So at that time we thought like these issues need to be highlighted, and we got like a little funding from icare then, and then it was decided that there is a strong need of a health maintenance tool which can inform and guide lifetime or lifelong health promotion and early intervention to maintain consumers' health, well-being, and social participation. So that was the rationale behind why we needed the tool. And as I move on, so from this slide onward, I will just give you an overview on how you actually use the tool to its full potential. So these are like slides which are more construct from the point that I'm assuming, like, because when we were like developing this tool in our mind, always that was the thinking that the primary end user for this tool is people living with spinal cord injury. But equally, we have like secondary user, which can be like family members, carers, general practitioners, like healthcare professionals, and also like formal and informal carers. So what actually a tool does, it gives you that understanding about your body, health, and well-being. So there is a particular section which I will flag as we move on, where like when we talk about like early days of injuries versus later time of with living with injury, you can actually go through that module in more acute phase where people can understand how spinal cord injury is actually changing the way their body works or their health or well-being. So just for a quick reference, when I'm talking about anything in the slide and I mention you, I'm referring to my primary user, which is people living with spinal cord injury. You will see like I mention a lot like in my talk as I move on about your spinal cord injury or like your health. I'm referring to people who are our primary end user for this tool. Then the second objective is like also preventing the problem which they're experiencing just in time. That's the second objective why we wanted this tool or how you can use it. You can identify if you have a problem, and if you identify there is a problem, you can also check using the tool how severe the problem is. Then you can manage those problems. It will give you some more general advice on some self-management tips just to prevent like some problem making it like more bigger and unmanageable. And then you can also track your health patterns and problems over the period of time if you're doing well with self-management, or you need to seek like specialist or a like medical healthcare professional advice on that. So I will show you like how all these components are embedded in the tool, and these 6 characteristics or the features which I presented on the team. This was very loudly came out of our out from our focus group and like the interviews we did with consumers in the engagement process, where they were like consulting at many different level of like development process. They were also like given like a opportunity to participate in a workshop where they're actually telling us how they want to see the information, how they want the information, how this will be done for them. So as I said, it was a very good example, and we felt proud that it was one of the gold standard project which tick all the boxes of consumer engagement and consumer co-designing and development process. So as I move on, I will say that the spinal cord injury health maintenance tool in current status, we have like 3 tools which you can access for free. The whole project from that like audit report, and then phase 1 where we developed the booklet version. And then there was a second phase of the project, which was digitalizing in the form of website and a smartphone app, was all funded generously by like icare over the last 5 or 6 years. And there are 3 resources which we have developed. The first one is more like the booklet version, which are like 6 standalone modules, which you can print as a PDF version. You can access these printed booklets from your SCI service provider or your health provider, where you just usually go, or you can write to us and we will be very happy to send a complimentary copy to you. Then the second resource was more around website, where all this information which was already existing in the booklet. The first phase was more around like developing those 5 booklets, which did not include the mental health module. And again, it was in our co-designing process was strongly come up as an outcome that there should be like a 6 module, which we call as a front and foremost module now. Number 1 module is the mental health and well-being module, which we have developed in the second phase when we were actually working on the website, and the third resource, which is our smart phone app. And I will give you like a glimpse of each of these resources as I move on in my slides, how they actually can be utilized and how you can make most of these resources. Just to make an important note around these navigational aspect of the booklets and the resources you will see as I move on with my slides. So we have actually have this color theme for booklets and website, where it's easy for you to navigate through any modules and you know which module you are actually visiting. So for example, we have like a yellow color theme for the mental health and well-being module, and similarly green color is done for the pain module. Then we have a similar like structural template what we created. And as I said, like this project was guided very strongly, like from a consumer perspective, like taking their perspective, their consultation, their engagement, as well as we have like a very active steering committee. And in our steering committee, there were like 2 advocates like who were advising at different stages of the project. And I will say like that one of them is Tony Jones from SCIA. And then we have our also the like regional and rural like representative from the community, which is Tanya Fitch, who's also attending today's session. So yes, as I was saying, like it was on a similar structure, so make it easy that when you're navigating through the tool, you can easily find information, because everything was like developed on the same template pretty much from all module. And I will give you like a quick demonstration as I move on the website, when I'll give you like a more hands-on demo of the website. Then each module, as I said, can be a standalone module. It's done from accessibility standard of AA, where you can see a lot of images, more interactions, rather than just static information on the website. It's more interactive, where you can like look at some features, and it's more effective principles of like that effective learning, what we think is a good way of presenting information, and it's not boring and it's more interactive and interesting. Then the content is written from a readability level of 8. And then the website, which is also what we created, was responsive. For example, if you're like going on the website, I mean by responsive that you can even see the whole capacity and whole features of the website on your smart screens. Like you can access the website on your mobile. You don't have to, if you don't have to download the app, you can still access the website on your mobile device without changing the format, or like sometime website on a small device can be clunky, but this is done in a way that you can also access the website on your smart device. Then I will talk about these 5 tools, which I think are really great resources which can help you actually in your daily living or daily life. Even if you don't see any problem, they're always good to do some quick checklist. And I will explain these, each one of them like quickly as I move on. But I just wanted to let you know that all these 5 tools are developed for all 6 areas on the health maintenance tool. So pretty much from that audit which was done in 2012, these are the 5, originally 5, but now 6 key areas where the tool was developed. But in future, we will be expanding more and more as we move on with the future phases of the projects. So for now, there are like 6 modules, which is on mental health, bladder, bowel, skin, pain, and autonomic dysreflexia. Now, if I'm just like moving back to the unique tools what we have created, so checklist is pretty much, you start with the checklist, which includes a set of few simple questions that help you actually to quickly identify a problem. And on the screen, you can see, like, I have just put 2 quick questions from the skin module. And you can see, like, they're like very quick question. And once you say like yes or no, it will ask you the next set of question and next set of question and make you like come up with like a provisional problem diagnosis, which you can actually, with some advice on self-management, you can manage by your own without seeing a GP if it's not like more like severe, which is over tool 3, which we will look at as we move in the tool 3, how you're looking at the severity aspect of any problem. Then you can track and monitor your bodily function and activities by using 7 interactive diaries, which we have created for these listed key areas. There's a mood diary, there's a bladder diary, fluid diary, bowel diary, pain, skin, and activity diary, which you can always use as a standalone document if you're tracking your health over the period of time, or if you're visiting your GP for one of these issues, or your healthcare professional, you can always fill for a few days and take that information to your healthcare professional, which I think will be a very productive way of presenting your symptoms and the problems you're experiencing. Then the third aspect is like more around the severity or the management index, which actually, once you have done that checklist, it will give you like a provisional diagnosis. And then based on your frequency, duration, and symptoms, it will give you like an intensity. So for example, for this example on the severity scale, let's say I was filling out that checklist and I was told that I have a provisional diagnosis of urinary tract infection. And I said like it's moderate because I know I'm getting this frequent UTIs per year, which is like 3 to 4 times. So I'll say like it's a moderate intensity. Then I'll go to the second scale, which is more around interference scale. And I say, yes, it is interfering in my lifestyle. When I had those symptoms, I cannot go out, or it's interfering with my daily activity. Let's say it's I'll choose some of the time. Then what it actually does in the next slide, you will see that it is actually giving you like a metrics where you can actually pick, I have moderate problem some of the time, and I self-manage with support, and it will give you like advice. You have to self-manage with support from your GP or other healthcare professionals. So less the severity, you can self-manage. As the severity and interference rating goes higher, you need more specialist advice on that. So they're like simple tools, but they're very like informative and helpful if you're managing by your own. Then the fourth tool, which is like toolbox, which we are always keen on providing some comprehensive strategies on a given problem. So this is more around the management toolbox, and like it is unlikely for any given problem which is related to spinal cord injury, one strategy may not be able to fix a problem. You need to use a combination of strategies, and most of these modules which we have developed, you will see as I move on, provide you with a number of strategies for a given health problem. So here is an example what I have presented from a bowel management toolbox, which will give you like 8 strategies, which might not be all relevant for a given health problem, but they give you like a more effective bowel management plan as you move on. Then the last tool is more around a personalized care plan, which is a PDF document on the website or on the app. We don't have this tool on the booklet version, but there is a template which you can use or fill. But on the website and app, it's more interactive and it auto-populates for you some of the stuff. But what this last tool, what we have developed, does that it will go through all the 4 above listed tools, like the checklist diaries, fetch all that information, populate it for you in the care plan, and present you, which you can share with your healthcare professional, or you can even update that when you're visiting your GP or other healthcare professional for a like more customized plan, what you need to do in the next few weeks or months for that particular health problem, or even for your general well-being. Okay, now moving, actually just give you a bit of understanding around how you actually navigate all these resources. So first resource I'm talking about is the booklet version, which is more static information. But one thing I would like to emphasize in the booklet version is the navigator. So this is how it looks on the booklet version, and the navigator is in all 6 modules, appears on page 4 of each booklet module. So the top heading, which I have highlighted there, is helping people with spinal cord injury to understand. It's going back to our 6 aims, why we needed this tool and what it's actually, how it's helping you. So it's actually giving you how to understand your body and how it's affected due to your spinal cord injury. The second heading is pertaining to more identifying a problem, that checklist and warning like signs you have to look for. Then the item on the column on the right is about prevention, when you are like actually not having problem, but you want to learn more about like some of the common conditions or problems you may experience or may not experience, or you are helping other people to help. So you can go to that like prevent and educate section. Then on the left side, it's more how you're tracking your health, looking at some of the common symptoms. Some of the like common like self-management tips are also provided within that, which will come once you start self-managing without support. Then at the bottom section, it's more around the severity, which we talked about, the severity scale and interference scale. Then lastly, it's based on what severity or the management index advise you. You either self-manage with support or with GP or with a specialist. Then at the last, you just based on your circumstances, if you think your goals are met, your problem is like resolved, or you are progressing well, you're not having like troubles with that problem, you can just like loop back based on your personal circumstances. Like you want to prevent, you want to re-educate yourself, or if even if you're not getting like favorable results, you can go back to identify problem and do the screening again, because sometimes severity might decreases or increases. So it's a good idea, if you're not improving in a week's or 2 weeks time, depending on what the problem is, you can always loop back and do the screening again on some of those questions. The second resource is our website, and this is our homepage. When you click on the link of the website, which I will provide you in a minute, you can actually navigate through the website. And on the website, there are multi ways to navigate the website. If you are visiting for the first time, I will strongly recommend that you put more attention on this top navigator, which includes pretty much everything you want to search on the website or you want to look on the website. So on this navigator, we will go to the real website in a minute, but on this navigator, there is a about page, which will give you information about the health maintenance tool, some of the features we are using. It gives you some unique information about living with the spinal cord injury, and also provide information for our secondary healthcare, like secondary health, secondary end users, sorry. One thing I just in particular want to emphasize that I would like to draw your attention that there is a subheading, which is aging with your spinal cord injury, which in my opinion is a great guide, which took us so much a long time to generate that in multiple sessions with consumers, co-designed it, what they want to know, how they want it to be presented. And I will strongly recommend, if you get time sometime, this is about how you age healthy with your spinal cord injury. And it will give you some unique advice on what you need to do 1 year or 5 years post-injury or 10 years post-injury. I think it's worth having a like look on this particular resource. Then the third tab is more about your health. This is pretty much the whole tool content what we have developed, which you will also see on the booklet version. And you can see all 6 modules are like structured on a very similar template. Like you have your bladder or bowel, which is more about how spinal cord injury affects your system. Then you have prevention. Then you have like some toolboxes. Then you have like this navigator or checklist. Then you manage your problem and some of the diaries, which you can also access. Then the fourth tab is more care plans. So on this particular page, you can access some of the pre-filled care plans if you know you having like a particular problem. So these are like all drop-down bars, which we can see, and they're like already existing care plans, which are pre-populated for more general information, not might not be more customized to you, but I think like they can be a good start if you're managing by yourself. Then you have a resource tab where you can access some of the resources for future or further reading, or you can access all these diaries if you're not accessing them in your health tab. There's a search button where you can actually not sure where to find a particular information you are interested in. In the search bar, you can type the keywords you're looking for and hit search. It will direct you to few close links what you're looking for. So these are like just keywords which you can put. And the last one is like more quick health check, which is more around automated version of the severity and interference scale we were talking about previously. So it will ask you like some sets of question, and you can answer like based on your situation, and then it will give you like a end product is more like a care plan and with a provisional diagnosis on it. The third resource is the smartphone app, which is right now rolled out. I will just wanted to prompt you that the Google Play Store have the most updated version of the app. The Apple Store, we are still working on the minor things. They have requested some information. There will be a version to release very soon, which will have more interactive features and more consistent visuals like diaries and all that stuff as it was rolled out. So if you're using like Apple phone, like stay with us like for another like 2 or 3 weeks, you will have the more updated version there. So on the app, as a new user, you have to create a profile first time. We ask some of your personal information to provide you with a personalized experience. So when I say like more personalized experience, on the booklet, it's more static. On the website, it's more general information. There is no profile you have to create. You can access website without any profiling, without any login ID or detail. But on the app, you do that because then it will create more personalized journey. If you want to track your health, you want to share your like journey with your healthcare professional, you can do that. But sharing is not automated by the app. You have to share it as a PDF document through email or other stuff. And as I said, we are not like capturing any personal or health related information from your device with the developers or even us. We don't have that access. The only thing we will access is how many people downloading that analytics around the usage, not how you're using it for your own personal journey. So that's more around the app. And then this is how when you log in, you will have 3 unique features. You can do diaries, you can do care plans, you can do quick health checks on your digital tool to manage your health. Then, as I said, like when you click that diary button, you can see it will pop up, and they're very user-friendly way of filling out, very quick and easy form, multiple choice, more interactive, a lot of illustrations. So it will be easy rather than typing. Most of them are like more tick, tick, tick rather than like you putting like notes and stuff. Similarly, care plan, it's auto-populated. Once you have done your diaries and quick health check, it will auto-populate for you and give you like some advice about a provisional health condition. Then you can also perform a quick health check anywhere, anytime. Then if you want to download the app, you can do so by using this QR link. And I'm very happy to share my presentation after this talk, and you can access these QR code then as well. In summary, 3 resources, booklets and website include pretty much everything. And as you can see on the website and app version, the health check, the bottom 3, which is the health check, diaries and care plan, they are more automated. Once you fill some information, it will store for you. It will create like a care plan master document for you. You don't have to do it like manually, which can be then shared with your healthcare professional. I would like to just, on behalf of James and myself, I would like to acknowledge that the support and guidance we receive from all these amazing people on the screen. And I just want to thank them all. And then there is a special thanks which I want to extend our gratitude to our funder, icare New South Wales, who have funded the 3 phases of this project pretty much. The icare team, the Kaiko Lab and Stepple, who developed the website, our graphic designer Ingrid Horton, who has developed the booklet version with us, in particularly our informant group, who were one of the key players in helping us refining this tool. And I noticed Emily Bray is one of the member in the audience today. So thank you, Emily. And I'm not sure Kobe and Sue and Jonathan are also part of this forum today, but I also wanted to thank them and our partner organization. And as you can see, SCIA also plays an important role in advocating for this tool and helping us refine it. And same thing, like I would like to thank Tony Jones and Tanya Fitch for their like really great contribution throughout the journey of this project, like 2 phases. They were so instrumental in this process. So thank you. And then that's all I want to say, but can I just quickly, maybe later once I've done the question, I just wanted to not trying to steal people, but we are actually conducting a trial, which is known as the SMART trial, where we are actually testing a promising new therapy for people with spinal cord injury. This is a non-invasive, like more visualization breathing technique we have implemented, and we are already seeing great results. If you are interested, just let us know and we will coordinate your visits. And I will not take much time on this because I don't want to be biased, but just for your information. And as I said, I will circulate these slides and this will be part of those slides. If you need to know more, happy to answer on that one. The last thing I just wanted to flag is the website quickly. And on the website, as you can see, these are the navigator buttons. You can drop down, and as I see, like, let's see like one mental health module. If I click the mental health module, it will download for it will just come on the website, and you can see the yellow color is the mental health theme. You can navigate from here. Like, for example, let's say we want to see the toolbox, and toolbox gives you like multiple strategies, how you improve your ability to self-manage your health, which is the important objective of the tool. You can, if for example, you want to like see, I want to manage your thinking or like manage, you can navigate through. There are some interactive features and like things which you can always access on the website. Equally, on the diaries, I will just give you a quick one. Let's say I want to use this sleep diary, which you can freely download from the website. You can put today's date, let's say 13th of September, 2023. You can fill this diary, like let's say 14:00, and you can share this with your professional or like healthcare professional or make notes. And if you want to make like more entries, there is a button at the bottom which says add page. It will keep adding pages as you go on. And as I said, they're like freely available. There are like 7 diaries which you can use at any given time point. Then the last resource, which I just want to quickly show you, this is a care plan, which is from the website. This is about Unitary. They're like pre-populated care plans, which you can access from the website under this care plan tab. And if you go there, you will see there are multiple care plans, what we have developed for different modules. For example, this is for bladder. You can access any of these for free. They are freely available for you to use. And as I scroll down quickly, you can see it will give you some common goals, which you can use, some of the education for self-management. And for example, if you're taking this care plan to your general practitioner, they can actually also fill some of the advice they want to give you at the same time, which I think is a very powerful tool because it's very engaging at the same time. For example, if your GP has given you some medication in the previous visit, they might want to say, can you stop this and change this so you have more updated information, what you were doing before and what you need to do now, like as a change. So these are like some of the resources I want to share. And as I said, I'm very happy to answer any questions if you have. Sorry, Tony, I went a bit more on time.
No, totally fine. Look, we have got a couple of questions in the chat. Ali's asking, will there be an SCI specific nutrition and weight management module down the track?
Yes, definitely yes. So thank you, Ali, for that question. there are a few things which actually came out of our like second focus group discussion, and we also met the peer support worker team from SCIA recently, and they were like some of the modules I think which will be part of the tool in coming years, and I will confirm that was one of the module which was actually prompted. The other one, if you're keen on knowing, is around sexuality. There was another one which was about lifestyle and I think that weight management, what you have just mentioned. So yes, it's a big yes.
Okay, good news. And Leala is asking, is there any plans or for a version other than English? So any other language versions in the Pipeworks possibly?
Sure. Thanks, Leala. Thank you. And this was also like one of the questions which we were asked a few times from the clinicians, like working in spinal cord injuries. And look, at this stage, I will say not, but we are very keen on making it more more productive tool as we move on. Maybe in future, yes, there will be versions of multiple languages, and I think we were actually told 5 key languages which might be helpful in Australia. So yes, in long term, I'll say yes, but I can't answer that long term can be like maybe 2 years, it can be 5 years, I don't know. But thank you for asking.
Terrific. And there's just some feedback from Tanya, who's saying that, not Tanya Finch, another Tanya, saying very useful info. Thanks, Mohit.
Thank you, Tanya.
Okay, so
awesome. I read awesome.
Any further questions from everyone?
I have a question, and it's just more a curiosity. Did you never think to develop like a chapter or a part related also to the family members of a person with a spinal cord injuries? Because I think that the tool, it's really interesting for the person per se, but from my experience working with person with spinal cord injuries, I had experience in Haiti after the earthquake. We realized that the family was an important element to, incorporate in this new life of the person. And I think sometimes they are quite lost, and it would be really good to have this kind of support with some tool as this one.
I totally agree. And I mean, I can direct this question to Tony and Tanya in the room, who sits on the steering committee. How many times we have discussed this? So, Laila, that's a very good question. And I will say that we were actually originally, when we have this thought of developing an interactive website, we were thinking like there should be a flip side of the website where the first question website asks you, are you a person living with a spinal cord injury? If you click that, you will see the website which are more written from their perspective. Then on the same side, if you click the button, I am a family member or a carer, you click that button, then there is a flip side of the website, like language is changed to a third person or a second person. And then similarly for GP. So that was our original plan, but the budget doesn't allow us to do that. But I think in one of our future development process, we will be very keen on doing that. Like if can actually provide you with some guidance. So for example, in one of our like focus group discussion with the GPs, GP mentioned they want to access the tool. When they click a button that they are GP, they want to see information they are actually providing to their clients. And it should be like more friendly in the way that they click the resource and they can print and hand it over to them, or they can direct the link based on what resources people are using. So yes, in future, this might be something you will see as the tool develop. I think the next phase which we will be focusing more on is evaluating the tool, like which are the things which we want to improve and like expand on. So yes.
Thank you.
Very valid point. Yes, thank you.
And I think in the feedback that we've had so far, including at the launch, there were comments around the usefulness for family members, and I note that people actually family members have used the resource for that reason, just to get better knowledge around spinal cord injury.
Yes.
I might go over to Tanya Fitch, as who was on the steering committee. Anything you want to add, Tanya?
Yeah, I jotted down some notes because I'm not really good at ad-libbing. So, yeah, basically, what my history is I've been a para, T4, T8 para since 1985. I reside in rural New South Wales. Prior to getting on the steering committee, my GP was very limited in his knowledge. I've had 2 GPs over the last 35 years and they are still very limited. And so what I was finding was if I had any health issues that arose, I'd have to try and reach out to the spinal outreach team in Sydney and try and work through it over the phone. And then also because I'm older, when Google come about, then you're trying to find answers online and there's mixed answers and solutions and you don't really get any true direction to your actual individual issue that's happening. So I think like the health maintenance tool is a big game changer, and for mild to serious health issues, like it's concise, it's easy to read, and it covers all issues associated with the bladder, the bowel, skin, pain, and AD, or autonomic dysreflexia, and the mental health and wellbeing. The interactive format is not only useful for newbies, like people that are newly injured, but also for oldies like myself and Tony. Tony and I were actually in hospital together, so back in '85, and I myself, I've used it. My GP has a copy. For my 3 monthly health plans, the emergency department has a copy because I presented there with an issue, and some of you may have experienced that not a lot of medical practitioners and nurses and that are actually familiar with autonomic dysreflexia. So, like, because you've got your little, I don't know if you've all got your little AD card, yeah, but that you carry in your wallet and that. But yeah, so they've got that on hand, and now with the app and stuff like that. So I've actually got I've got the paper copy, and that's in my emergency bag. I have an emergency bag that's like a hospital bag, ready to go in floods, fire, hospital, COVID, whatever. And then I've also just got, what you do when you're hospitalised by Royal Rehab, and I've just got that. And because when you're sick, even though you may know the things that are wrong with you, or the things that have to be what your treatments are, you're not always coherent. And sometimes professionals just don't listen to you. You know your body, but sometimes their limited experience or knowledge, they don't have the information on hand, and sometimes they just don't listen to you. So this is an excellent resource, and I know my GP, he's got it, and he's got a couple other clients with spinal cord injury, and he's actually used it as a resource just to get some sort of direction as where to go. So that's my little spiel.
Yeah, I can relate to that, Tanya. So yeah, cheers. Any further comments or questions or feedback? All right. Well, Mohit, thanks very much for all that great information, and much appreciated. Okay, so we have Emily Bray, Social Worker and Research Fellow at Griffith University, the Hopkins Centre, Brisbane, to speak about the resilience programs that SCIA run. So thanks a lot, Emily, for making yourself available.
No problem, it's a pleasure. So yes, my name's Emily. I've been working with SCIA since 2016 in a number of different roles, firstly in peer support, as I have a spinal cord injury myself, and then now more recently as a social worker, kind of developing and running what we call the resilience programs. So today I'm just going to take a little bit of time to talk about the two programs that we're currently running, and give you a little bit of an insight into the topics that we cover, how we run them, and then when we're running them. I will share my little presentation for you. Bear with me one moment.
I've just put the link in the chat to if anyone's interested on the SCIA website with a bit more info about the programs that Emily's about to chat about.
Thank you, Tony. So I guess this all began a couple of years ago when we were looking at our suite of services. Now, obviously, we run peer support in the hospitals in Sydney, and we have a little bit of community peer support, but we really identified that there was a lack of support in the community addressing mental health. We all know that, spinal cord injuries and other acquired disabilities, they impact not only, our physical health, which is often addressed in quite a lot of detail in that rehabilitation time, but perhaps not so much the mental health side of it, and especially when we get into the community. But evidence does suggest that focusing on things like well-being and personal resilience can improve our mental health and enjoyment in life. And focusing on, finding meaning in our lives is also means we're better able to cope when adverse events happen later down the track. So our programs, our resilience programs, or our mental health and well-being programs, we also call them, were really designed to help our community develop resilience, build personal resilience, and build and strengthen their mental health and wellness. It's all nice to think about, great resilience, but we throw around this term a lot. What does it actually mean? What does building resilience actually mean? So resilience is this idea that we can bounce back from a crisis. It's the ability to go on with life after hardship and adversity, and to remain psychologically healthy despite very difficult circumstances. So the two programs that we run at the moment kind of address this in two different ways. The first looking at this idea of the ability to go on with life after hardship and adversity, and the second looking to remain psychologically healthy. The first program we run was developed through an icare grant by a team of researchers, so a pain specialist, a person with a disability, physio, OT, and also in collaboration with disability organizations, and co-designed also with people with spinal cord injuries. And this is the ENGAGE program. The ENGAGE program wants to support people to adapt and continue on with life after acquiring a disability. So obviously Spinal Cord Injuries Australia, yes, our main client population is spinal cord injuries, but we also have people with multiple sclerosis, strokes, and other acquired disabilities using our programs. The second program we run is called the Wellness Recovery Action Plan. It is, again, a evidence-based program that looks to support participants to remain psychologically healthy by putting safe and accessible tools to support our mental health. So we've got these two programs we run, and I'm going to just run you through, firstly, the ENGAGE program, looking at, I guess, the content that we cover within it. So the ENGAGE program is based on this concept, or uses a framework of post-traumatic growth. The post-traumatic growth, the framework is described as the experience of positive change that occurs as a result of the struggle with a highly challenging life circumstance or crisis. I always like to say at this point that, post-traumatic growth is not necessarily saying that our lives are better because we've experienced a challenging circumstance or crisis. That's not what we're saying at all. But we're saying there can be some positive growth that happens as a result of going through a really challenging experience. This growth typically occurs in 5 different areas. Generally, it might look like a stronger sense of meaning and purpose. People might experience a greater sense of personal strength. So, for example, they may feel that they are more patient, they're more empathetic. They may have a greater appreciation of life and changed priorities. They may have found connection with others or a higher power. So maybe you've connected with a group or a new sports team, or the identification of new possibilities or opportunities. Again, maybe you can't do certain activities that you did prior to your injury, but you found a new love of reading, you've joined a basketball team, there's some new opportunity that you've engaged in. So these are the areas that generally post-traumatic growth is seen in. So what we do throughout the Engage program is kind of use this as a framework for each of the different weeks. We explore it in more detail. So one week we look at our personal strengths, identifying what our personal strengths are. One week we look at what meaning purpose is and what does that look like. Identifying, the smaller things in life that bring greater appreciation, and then also looking at relationships with others and activities. So as you can see, the 3 main areas that we look at are engaging in self-reflection about what's meaning and purpose, what are our personal strengths, how we can engage with others in a meaningful way, and how we can engage in activities that are meaningful to us. I'm going to focus today just briefly on the connection with others or higher power and how we can look to engage in more meaningful relationships. Throughout the course, we kind of pull on the research that's available to kind of support some of these concepts. And one of the research topics that we look at and why relationships make life meaningful, these studies. And I do acknowledge that they are old studies, but I think it's still relevant. And as you can see across the 3 age groups, relationships by far outweigh other areas of life in making life meaningful. And during our course, there are a few questions we ask before we get to this. But often participants identify for themselves that relationships are by far the thing that make their life more meaningful. And this research really just backs that up, I guess. But it's consistent across all age groups, which is really interesting. So in the course, we come together as a group online and we kind of brainstorm what relationships have been important in your life, and perhaps this is something that after this chat you want to go away and ask yourselves. But what are the relationships in your life that have been really important and instrumental? And then I think more importantly, what makes those relationships important to you? What makes those relationships meaningful to you? Is it a shared history, a shared love of an activity? Generally, there's something about the relationship that makes it meaningful. So by delving into these questions and chatting as a group, it really helps to identify what relationships we have in our life, what makes them meaningful. And from there, we can kind of look at identifying if there's gaps in our relationships that we could maybe seek to fill, or if there are meaningful relationships we have in our lives that perhaps we want to put more time and energy into and reach out and reconnect with that friend or that family member. And we talk about relationships really as being quite a broad spectrum of support systems, rather than just family or just friends. Because I think that when we talk about relationships in the group, people always say, oh, my partner, my brother, my children. We try and expand that somewhat, because I think that we have relationships in all different areas of our lives. Those that we are emotionally intimate with, whether that's your partner, your parents, a spiritual person, a pet. We also have friendships. Some friends come and go, friends from work, friends from school, etc. We have friends where we do things where we call them, that category of participation, but it's perhaps you interact with your work colleagues at work, but you wouldn't necessarily go for a coffee with them on a weekend. But it's still a relationship, and you still might find those chats over the water cooler meaningful, and they might bring you joy to your day. And then lastly, those exchange interactions you have with someone. So it could be your psychologist, but it could also be your local barista that you go to every morning, and there's that, it only has to be a 30-second conversation where say, hi, how was your day? Usual coffee today? Yes, great. How are the kids? Whatever it may be. So all of these relationships are important in our lives. They are all meaningful for different reasons. So when we look at relationships within the Engage program, we're really looking to explore a whole support system, what relationships we have, what makes those meaningful, and how can we build those in our lives to bring more meaning, purpose, and joy within it. So the Engage program is a 10-week program that we run online in a group. We have 6 weeks where we address the content, which are relationships, activities, etc. We then have 3 weeks of one-on-one coaching, where we take the content that we've talked about for 6 weeks and we apply it to the individual and their experience and where they would like to look to grow in the future. We try and develop a few goals, to whether that's building more relationships, whether that's engaging in a new activity. We try and really apply the content to their lives and their goals and their interests. We then come back together for one final week where we kind of reflect on where we've been and what we've learned in the one-on-one sessions. But I think the really nice thing to see is even online, this group process really results in nice relationships being formed, and the conversation is really meaningful for individuals and can delve into some of those bigger topics that people enjoy. I'll move now on to the second program that we run, which is the Wellness Recovery Action Plan, which addresses that second element of resilience, which is to remain psychologically healthy despite difficult circumstances. And we really try and do this by supporting participants with putting in place really simple and accessible tools that they can use to support their mental health. We do this by developing plans and looking at some core concepts. So we have what is in the umbrella are our core concepts. So we look at the importance of having hope that our mental health can get better. We'll look at personal responsibility. So it's the idea that we need to take responsibility for our mental health, educating ourselves around our mental health, self-advocacy, which is advocating for what we need in regards to our mental health, and then support systems, which is kind of a little bit similar to the relationships aspect that I talked about briefly in the last program. We also develop the plans, which are the weather system that you can see over the top of the umbrella. So we develop a daily wellness plan, which are things that you need to do every day to support yourself. A plan for when perhaps you're triggered by an event, whether it be a person or whether it just be going into a crowd, what you can do before that, during that, and after that to support your mental health. Early warning signs that things might be starting to go downhill, and then also a plan for when things are breaking down. And I like to just decipher between the two by saying, when I'm feeling mentally well, I will leave the house and maybe my neighbour's in their driveway, and I'll interact and I'll have a conversation, and I'm really happy to do that. I love to do that. An early warning sign for me that maybe my mental health isn't in the best place is I see them and I think, oh, I really don't want to talk to them right now, but I'm probably still doing it. I'm just thinking, oh, I don't really want to go and talk to them. Then when things are breaking down, I've seen them and I thought, I don't want to talk to them right now. I'm going to stay at home until they leave, and then I'm going to go out and do whatever I need to do. So there's kind of the 3 different stages that I break it down into, and we look at different things we can do at each stage to support ourselves with our mental health. And it might be kind of you're using bigger tools and strategies as you go down that kind of path. So it's the kind of things we're looking at. And then we're looking at, we also develop a plan for when you're in a crisis. So when things are really breaking down, who you want to come and support you, who's going to be taking you maybe to hospital, who's going to be feeding the dog, that kind of thing. And then for after you're better, post-crisis, what do you need to put in place? Maybe you want your mum to come in and make sure the fridge is full. Maybe you want to make sure that someone's emptied the bin. All those things that you need before you return home, or whatever a crisis might look like to you. Delving a little bit more into detail into just 2 of those topics, I just thought I would look at personal responsibility, which is this idea that we have to take ownership of our circumstances and make changes towards achieving emotional wellness. We run this course for both people with disability and carers, and it was really interesting doing this with carers. We just completed it as an idea of not only do we need to take personal responsibility for our own mental wellness, but for carers and family members, sometimes it's about relinquishing personal responsibility for the person they're caring for's mental health and well-being, and that person themselves needs to pick up that responsibility. So that was a really interesting point of note that came out of our last session that we ran. But what can personal responsibility look like? Taking action to promote your wellness, knowing your needs, knowing a plan for wellness, being responsible for our responses. So it's the whole idea of, we can't sometimes change the circumstances, but we can change how we respond to the circumstances. Also having self-compassion for ourselves and releasing others or yourself from blame. What can we take personal responsibility for? It can be small, it can be walking the dog, taking your own medication, taking responsibility for how you allow people to treat you, your own actions, things that matter to you are in line with your values, just knowing what you need, your physical health, your mental health, lots of different areas that we can take responsibility for. And we always like to start small within the program. Sometimes making change to take responsibility for our physical health is too big a concept. Perhaps it's just taking responsibility for engaging in one physical activity a week, whatever it may be. Really try and break it down. So again, giving you a little bit of homework again after the session. Have a think about what can you take personal responsibility for in your life and how. And then I think a lovely, one of my favorite parts of the Engage program is this idea of a wellness toolbox, which is a list of skills and strategies we use for keeping ourselves well and for feeling better. And they're simple strategies, safe, accessible. Sometimes they're free, the things that we can do to help maintain our wellness, give us hope, help us feel connected. We use this toolbox to develop the plans, the daily wellness plans, etc. to help support our mental wellness. It can be a list. It could just be a list that you've written down. Some people have actually developed a box of things. But the important thing is to keep it really simple, because when you are in a frame of mind where you're really struggling with your mental health, sometimes it can be difficult to think of things to bring you out of it. So the idea of your toolbox means you can go to your list and think, oh yeah, I really do enjoy reading that book because that's my favorite book. I'll read that. I'll watch this movie. I'll listen to this CD. It's all there, really, really easily accessible. So some of the things that we have, people have put in their toolbox are journaling, having a healthy snack, sitting in the sun and having a cup of tea, going for a swim, watching your favorite movie or TV show, listening to your favorite record, making sure you've taken your medications, doing some meditation or some breathing work, going out in the garden, doing a little bit of weeding for half an hour, or even just sitting on the couch or in your chair and talking to your animal, giving them a little pat, going for a walk, whatever it may be. We try to be really simple things that we can do and access anytime. And then, you know, there's also an element of when things are breaking down, perhaps having a few bigger things in there, like organizing a massage, you know, calling a friend. But again, simple, safe, accessible. So again, have a think. What would you put in your toolbox? What would you put down on your list to support you in your mental health and your well-being? So lastly, to finish up the RAP program is a shorter program. It's 8 weeks, all run online again in a group setting. This one is all run together. We don't have that option of one-on-one coaching for this one. It's run for, so the Engage program is generally just for people with disabilities or acquired disabilities, where this one we do one for people with disabilities and one for carers and family members. So again, coming back to this idea of resilience, the ability to bounce back from a crisis, we're trying to support people to feel like they have the ability to go on with life after the hardship of adversity and to remain psychologically healthy. You can find out more information on the website. Our next Engage program starts on Wednesday, the 11th of October. That's our last one for the year. And then next year we will run, we tend to do 2 Engage programs, 2 RAP programs a year. Dates haven't been decided yet, but they will go up on the website, and we often send out newsletters and social media posts whenever they're coming up. It does always depend on numbers. We always say we have to have at least 4 people per program to run it. So if we don't have 4, we will probably postpone it and put everyone on the next program. But other than that, you can send us an email. All the links are on the website. I just saw the question pop up about the NDIS, so I'll just quickly mention that these are all free programs. There's no cost to the participant. So you can just contact us, we'll put you on the list. It was really important for us that these programs be accessible for people to access in the moment when they're experiencing mental health concerns or need support. And sometimes if you don't have it in your NDIS plan, it could take, who knows, 6 months plus to get it in there, and we didn't want people waiting. So that's the reason we have made them free and hope to continue to do so. Thank you.
Terrific. Thanks, Emily. So if someone is interested, it's just a matter of contacting SCIA, yeah?
Yeah, you can call SCIA and they put them onto us. You can go to the website, or you can email us at resilience@scia.org.au.
I'll just throw it open. Anyone else got any questions? I mean, I know for myself, mental health sometimes goes up and down a little bit, and sometimes you sort of withdraw into yourself, and I find myself doing that, and I can relate to the neighbour experience and avoiding that at times, even though I've got good neighbours. So yeah, it's certainly helpful to be mindful of those things.
I think it's also like part of the process of both programs is acknowledging that grief comes and goes within our lives as with spinal cord injuries. Sometimes it may be really quiet and sometimes it's a little bit louder, and that's the same with mental health, and that's okay. And it's just about having strategies and tools in place for those times when maybe that grief is a little bit louder than others. And it doesn't even have to be related to your spinal cord injury. You could just have lost a friend, have been made redundant, or whatever it is. There's lots going on in life that nothing isn't necessarily related to your injury, but the injury is often the underlying cause that brings everyone together in the programs.
Tanya's just saying, thank you for allowing carers to access these services, because I guess that's an important element as well.
Yeah, absolutely.
All right. Well, thanks a lot for presenting, Emily. It's much appreciated.
No problem. Thank you for having me.